So thank you. I'm Dr. Mark, as you know. Thanks for coming along. Thanks for sourcing us out. And it's a very low-key presentation tonight. So it's about you guys. I'm here to part the information I've got across in a kindly fashion that everyone understands. And there's a lot of information out there. YouTube is brilliant for finding information in the web on implants, but it's a little bit all over the shop. So we've been doing it in-house here for 16 plus years, still studying. So this is my little story for you tonight to get to understand what we do with implants up in Gympie. So what is the plan for tonight? Why should you trust me? So that's the big thing. Why am I still studying? So I'll explain a little bit about that. And why do I really love doing implants? And that's part of the journey tonight. So I'm going to deal with some roadblocks right at the beginning so we can deal with that. Cost, pain, and time. They're the big three roadblocks that I get asked all the time. You know, how much do implants cost? Pain, time. Jen was in here yesterday. So Jen, we had that discussion already, didn't we? Yeah. So we'll talk about that tonight. So what is your investment? Well, each case varies and each case is complex and unique as it needs to be per your mouth. So if you're having a single implant, something very simple, it can be $4,000 to $5,000 all up. But usually it's broken up over a period of time. And the first stage where we place the implant, it's $2,000 to $3,000. And the final stage to actually put the crown on top. And they're the concepts that I want to explain to you, what a crown is, what the implant is, and why they cost so much. And I've had everything thrown at me. We've been doing this game for a long time. Well, I can go to Bali and get that done for a tenth the cost. And I do treat those patients that do come back from Bali when things don't quite go right. And the implant company that we use is a BMW kind of class implant. And why do I use that? Because it works, because it's got the most research and development, and it's been around the longest. There are a lot of cheap substitutes on the market, and I've played with about 6 to 8 different implants for different reasons, and I keep going back to the tried and trusted one with the most runs on the board. So implants, I won't hide away from it. They are expensive. They are an investment. They're not cheap, and they're not done overnight. And cheaper is not always best, and I think we all know that. Tried multiple systems, and also, what I'm going to introduce you shortly, my technicians that I work closely with are here tonight. So our work is not outsourced over to China, where I can get stuff done for half the price, but I don't know quality control, I don't get the same aesthetic outcomes, and things don't fit as well. So my work's done at Budrum, and the implant company that I use, they came out of Switzerland and Sweden. So European implants and a local company that does my lab work. And you're going to see some of that work tonight. So just talking about pain quickly, and the health protocol and surgery experience, I've been doing it for a long time, so I've learnt some surgical skills on how to do things gently, but still get a nice result. I had my own experience. I've just come out of a little template. I've broken a bone in my wrist, but I actually had the experience of talking to the surgeon last night. And I've got trust in him already that if I do need surgery, I know who to go to, because he explained the concepts in the actual inside. So I'm hoping that I can do the same tonight. So that's why we have these implant evenings. That's why we do a lot of consults. We do a lot of talking before we actually get down to the surgery time. But the experience, I'll give you a bit of a rundown of why I'm experienced. And I do a bit of a health protocol that's now coming to its fore. A lot of other surgeons are starting to use a little bit this to help decrease swelling and pain after surgery. And we use medications as well. So how long does the process take? I'm mid to late 50s. I'm a very impatient male. I'm an A-type personality and I'm OCD. and I like stuff done quickly. But when it comes to this, even myself, I've got to take a deep breath and also tell my patients to take a deep breath, because we're actually dealing with your human body, we're dealing with cells, which I want to explain to you tonight. We're actually dealing with the healing process when you actually place an implant into your body. So it's a foreign process. It is an injury that then we turn into a healing scenario that we actually get the implant to take to the bone. It takes time. So it's something that you can't rush. The body needs to heal. So if a patient, and I'll show you some cases, lost the front tooth, it's just devastating, but they want that fixed straight away. So they want it looking the same as it was before the accident, if it was an accident. So the pressure was on me to perform it quickly and turn it around in a timely fashion. But the same token, they're spending $4,000 or $5,000 or more if grafting's involved to get an outcome, and it's got to last a lifetime. So I've got to make sure it works. So it's a balancing act of letting the body heal and not pushing the envelope, letting the bone cells grow back around the implant. At the same time, being conscious that this patient doesn't want to be walking around with a gap in the front of their mouth. So there's pressure on both sides, but we try and make it please the patients as best we can, but at the same time, not crossing the protocols of the body healing. So there's a few steps, and I do immediate implants where I can take the root of a tooth out and place the implant with grafting at the same time. But generally the implant is placed 6 to 12 weeks after the tooth has been taken out, or in some many cases, many years later. But it needs to be left alone for at least 12 weeks. So it's a 3-month period of healing before you can do the next stage. And the next stage I'm going to explain tonight is how we take the impression and actually make the crown work on top. So Jamie, could you just hit the play there? This is just a little story. Thank you.
Hi everyone, we've got Tracy in today. We've had a bit of a journey, haven't we, Tracy? We certainly have. Yeah. So Tracy, just give us a smile so everyone can just see. So what we've done, we've got a bridge on the front. We've done some implants top right, and implants top left. We just put a bridge in quadrant 1 and in quadrant 2. Yeah, Tracy's on as well. So Tracy, how did it go from start to finish? It's been a big journey.
It's been a long journey, but it's been a really good journey. No problems, not really. I mean, considering that I had not much bone there, I had to have a sinus lift and a few other things happened through the journey. But no, it's been a really good journey and I'm happy.
Yeah. So a happy outcome in the end.
Yes, very happy.
Okay. Thanks, Trace. That's all we need.
So that was a case you can you just click that forward for me, Jamie? That's the case we just completed this year, a happy outcome. But that lady came from the Sunshine Coast, sourced me out, and she needed grafting. There was a lot more complications there than a normal straightforward case. That nice smile that you saw, that was completed by Justin and Darius sitting over on the side here, and I'm going to introduce you shortly. But it was a beautiful outcome. She had really no teeth on the top. So we've done a bridge, we've done some implant bridges on the side, we filled her whole arch up. And that was like a 12, 18-month process of work. But she knew what the end goal was. She didn't want to wear a denture any longer. And she made multiple trips to the lab and up here for the surgery. And it went well. So that's why I love doing implants, seeing that end result. So I'm very passionate about what I do. It does keep me awake at night at times, agonising over cases and planning them. There's a lot of pieces to put together. It is like a bit of a jigsaw. But at the end of the day, if you can get results like that, it makes it very pleasing. So I've actually, in the respect, turned my work into a hobby to a degree, but a highbrow hobby that it's just something that I take very seriously as well. Thanks, Jamie. I've just lost that clicker there. So, my team, and that's Jamie helping me at the back. So, you're only as good as the team around you. So, we've got a highly skilled team that help me do my casework. And it's in collaboration with Jade Dental, Justin and Dara. So that's Dara's here with the mask on and Justin. You'll get to talk to them a little bit later. And also Julian from Nova Biocare at the back there as well. So these guys are going to hang around tonight just to answer some general questions as well at the end of the presentation. And we've been working together for many years now, and the casework that you'll see tonight is mostly their work. Study. So I've studied a guide program out of LA in Australia. So that's a master clinician program in implants. I've also been to Colombia twice, been to Madrid, and currently started a grad dip program with Professor Meredith out of Brisbane and JCU, with Luke that's working in the practice with me, and mentoring a group of about 8 to 10 dentists down the sunny coast, where I'm running some lecturing and training them and passing on my knowledge. So I don't sit still for very long, but as I said, it's a passion. There's so much still to learn. The techniques are changing all the time. That's in South America, that's in LA at the course there that I did. That was Loma Linda, that's Madrid. So I just want to quickly ask, I'm doing all the talking. Is everyone here from Gympie, or we got everyone, no one not from Gympie? Yeah, where are you from, sorry? Hervey Bay, so you've come a long way tonight. And you're Hervey Bay as well. So thanks for coming down. And there's guys that do implants up there and quite well as well, but thanks for coming down all this way. And as people have got some missing teeth, you don't need to tell me a story now. You just if you got some missing teeth, yep. That's kind of like what you're here for, to hear about it tonight. And who's worried about cost and pain? Is that's your main concern? So I may not have answered that fully, but partly as the story goes on, I've put those points right up, because that's what we all, we go and buy a car, we all want to know what it costs, basically. We want to read the reviews, but we still want to know what the bottom line is. And basically, every case is unique, but I'll tell you what you'll get once we've worked a case up, what you get to take home, that then you can work it out and see whether it's worth it for you or not. So let's get into the story. These little pop-ups of ideas, I've had many patients come in worried that their dentures will fall out at their sneeze. Speech is a big thing. Eating, so just plain function. That's the most common one that we see. Yes, if it's a front tooth, it's aesthetics, but it's also function. And smiling, self-esteem, just being natural again. And that was what that lady just said, that she was happy, she can smile, she's not self-conscious, her teeth aren't falling out. So we're restoring function, self-esteem, and giving people their lives back. It's very rewarding. So we're looking at physical health, aesthetic health, self-esteem, just things that can compromise your quality of life by just having 1 or 2 missing teeth, let alone a whole arch. This case here, so on the left, it's before treatment. On the right, there's some implants and some crown work. It's the same person. And that's just kind of the work that we can kind of like turn around in our lab now. So this is just starting to now get into the journey of what an implant is. We're trying to replicate a natural tooth. So the metal anchor is the piece that goes into the bone. So that's the bottom bit. And then we have an abutment. So that's a term that we use a lot, a dental term, and that's the piece that screws on and sits inside the actual metal rod and a crown on top. So in essence, your first bit to take home tonight is that when you purchase an implant, you're actually getting 3 pieces. You're actually getting the metal anchor that goes into the bone, a little piece called an abutment made out of ceramic or metal that fits inside your implant, and then a crown on top. So we're trying to copy nature. We've got the crown, abutment, and the implant. Jamie, could you just go back 1 slide, please? Thank you. So this is another take-home message, bone and bone loss. So the top diagram represents the maxilla, or your top jaw. The bottom diagram represents the mandible, the lower jaw. And A to E are time frames. So A is a cross section of a piece of bone out of your top jaw, not long after having teeth out, and E is possibly many, many years later. The same with the lower. This is like a section of the lower jaw, not long after removing teeth, but progressively you can see we have bone loss. So I get asked this question a lot. I've had teeth out for 5 or 10 years. Am I a candidate for implants? Each person is different. If you've got some retaining teeth, that actually tends to hold the bone. But when you start losing all your teeth, the bone does shrink away, fade away over a period of time. We have got new techniques where we do grafting. So nearly every case that I do, we do some grafting where we actually grow some bone back, restore some lost bone. So we've got new techniques to kind of like restore loss of bone. That lady that there again spoke, she talked to you about sinus lift. I'll explain a little bit later, but that is a technique where we lift up the sinus membrane at the back of the maxilla to grow bone, so then we can place implants in there. But everyone is different. We do a CT scan, which I'll explain a little bit as we get along, on measuring the bone height and width and to work out what you've got. There's that diagram again. The crown at the top, the abutment in the middle, implant at the bottom, so that those 3 pieces. So 3 common types of cases that we deal with: the single missing tooth, several missing teeth, and then a full arch case where all the teeth are missing. So this is probably the most common case that we commonly do, missing front or side tooth. The options are, if you've got one missing tooth, we can do a denture, we can do a bridge where we cut up the adjacent teeth, or we can do an implant. And Jen, this is what we kind of like discussed yesterday, plate, which you've had, bridge. And I'm really against bridges. We used to do a lot of them. We still do them from time to time. But if you've got to cut up 2 beautiful adjacent teeth, when you can keep well away from them with an implant, we always go the implant part now. This is 2021. So bridges have got a place and they're still used. But if we can place an implant and not tackle the adjacent teeth, it's a far more conservative approach, in my opinion. Not everyone agrees with that, but that's the common thought. The issue with dentures is they flip-flop around, and they're like a semi-permanent kind of arrangement, and they tend to break and wear out. And there's just some cases of 2 missing front teeth. That's the laboratory work, so you can actually see the crown. That white piece that you can see, that's the abutment that sits underneath the crown, and that's the finished result. Dentures, quickly touching on that, the limitations are they don't stay in very well. So I've worked with a number of cases now with Darius where we've had a denture, we've actually put 2 implants in, not a whole arch of implants, just 2, and we put locators. So I'll show you them a little bit later, little clips inside the denture to stop it moving up and down, to keep it in place. Or another case, we're just finishing off at the moment, a full arch. So we're placing 4 or 5 or 6 implants, and we make a bridge that screws in place. And that's your all-on-4 technique, which we'll cover in a little bit, or it could be all-on-5, all-on-6. So the steps. This is starting to get into why it takes so long. You can go to Bali and get it done in a week. You come and see us and it takes quite a while because we do a lot of consulting. So you come in initially, we check your medical history to see whether we think that you're a sound person to consider implants. There's some considerations with that. Then we might do a CT scan. So we have our own in-house CT scan here, where we then do the special X-ray. That is then downloaded onto my laptop. I then work on it with some virtual surgery on some software, do my measurements. We then sit down and we discuss the case, and then I'll go through the planning and what's involved. If we're happy to proceed, then we book the surgery. The surgery we usually do in the front room. We set it up like a mini hospital so you can see all the blue drapes there. And a patient was telling me yesterday with this whole COVID drama, dental surgeries, particularly when accreditation came in, one of the cleanest environments. We run like a mini hospital. We always have and always will. I know that you got your masks on tonight, which is great, but we do take infection control very seriously in a dental environment. Then we get to the prosthetic side. What that means in a dental term is we make the tooth, the crown that fits on top of the implant. And then finally, we call it recare. So we don't just put an implant in and forget about it. It still needs to be maintained. You need to come in yearly for me to check the gum health around the implant, just give you some coaching. So you don't forget about it, don't keep it clean, you must look after it. So there's quite a few steps. So I mentioned CBCT. It's a cone beam computerized tomography, which is a mini CT. If you break your leg, your arm, whatever, you go to the radiology clinic and they do a special x-ray. This is a mini version just designed for the jaws, and it's low radiation, and we've got a new machine in-house. It takes me about 60 minutes to plan up a case where I can measure the bone height and width, select the appropriate implant size to see if grafting is needed. So if there's a little bit of lack of bone, whether we need to add some grafting, we talked about that case, Jan. And then we prep up and we do the costings. So then we can prep it up and then we sit down and go through the case. This is just some diagrams showing you what a CT and the virtual planning, so you can actually see some little animations of implants in there, so we can work out what size, what width and what length of implant we can place in there. Not that we would do 4 in a row like that, but that's just gives you an animation of the implant and then the crown work on top. That's the finished case on the right. When we're placing implants, we've also got anatomical structures that we've got to keep clear of. The lower jaw, we've got the mandibular nerve, so we've got to keep well clear of that. On the maxilla, it's the sinus and then the size of canal as well. So we've got a few parameters, and that's what we do the 3D planning on the software for, just to work out where these anatomical problem areas are and keep well clear of them. Just some more diagrams so you can just get the positioning right. That's just giving you an example of what a sinus looks like. So I mentioned before that lady that did that little chat for us before, she had a sinus lift, so she didn't have enough bone at the back of her mouth. So we actually did a special surgical procedure. We lift up the floor of the sinus and we place graft. I'm talking about graft a lot. So that's something that's becoming more topical, and a lot of people are tapping in the keyboards to see what it is, and I do get quizzed about it a lot. When we do a sinus lift graft, and I'll give you some examples of some photos in a minute, we actually take the patient's blood, we spin it, and in your own blood are growth factors that aid healing, and we use a concentrated version of that. When we cut a little bony window into the side of the sinus, we preserve that bone and we mix that with that graft blood product. We also use a bovine bone that's been deproteinized and a cadaver bone, and it's all doing TGA approved. So that's the big thing about traveling overseas and stuff. If they start using graft materials, really don't know what they use. And the Australian TGA is one of the hardest TGAs in all of the world to get a product approved. America's far easier to get new products in, and New Zealand's far easier. Australia's really tough. So you just heard Moderna was just approved, I think yesterday or the day before, one of the vaccines. It's really tough to get it approved, any kind of product that's used in the human body. So grafting's been around for 20 plus years, and it's very safe. What it does is acts a bit like, an analogy I use is a bit like gardening. If you were to buy a new plant, a new rose bush, you don't just jig a hole and just throw it in the hole and hope for the best. You usually mulch up the hole where the plant goes. The graft is not living material, but it adds as a matrix to allow blood vessels to grow through it, and eventually attracts new bone cells. And it converts to hard bone over a period of 6 to 12 months. So then you can come back and place an implant. And it's a technique that's used all over the world. Yeah.
Just heard you use that word bovine and cadaver in the same
Yes.
sentence.
Exactly.
Just fill us in.
So bovine bone, the product's called Bios, the one that I use. So that comes from cows.
That's what I figured.
Yes, and it's calcium phosphate. So all bone is the mineral part is what we use. So there's the prions and all the other nasty stuff that they have in one of those diseases, that mad cow disease. That's all been proven. It's all been stripped out of it. You can't actually get anything from it. So you hear about knees and hips being done all the time. Yep. So every second, well, not every second person, but I know a lot of people have had their knees done or hip replacement. You would have had grafting done. You may not have even been told about it.
And it
But
would have
there's-
been sourced from a cow. Or
they use, I'm not sure exactly what each surgeon has their own recipe. They would either use autogenous, so they use some of the bone elsewhere from the body and move it across there. They use shellfish, so they actually use a coral. I've heard them using as well. And I'm sure they would have used bovine, which is a very common one, cow bone. So, yeah. And
it's like a matrix.
it looks like white powder. And what it does is osteogenics. What that means is it has a potential to attract new bone cells. It actually has it has a field of force still available. And the analogy, which is nothing like it, but it's, as I said, you mulch up your plant, you want to put your plant in, you want the roots to go through it. What actually happens when you graft, blood vessels grow through the graft first, not bone cells, but they attract new bone cells through the blood vessels and convert that dead bone, that's what it was, dead cadaver bone.
So it doesn't actually, when you say diminishes, it
It's
doesn't just get washed away in your
in
body.
time, the actual cells do swallow it and break it up.
Right, but before then it's still just sitting there. It's like
Yeah.
dead coral reef.
Dead coral reef,
Okay.
exactly. And coral reef is probably a good analogy as well. But dead, but we bring it back to life again. Yeah. So they use it.
I don't reckon I'm going to need it.
But knees and hips, they do it all the time. And footballers, if they've ever had an eye socket, if they've got a bit of a defect there, they'll graft it. Yeah, it's used commonly. It's been all orthopeds use some kind of graft and bone glue. But don't ask me what's in bone glue. So the good question, and
Well, vegos are going to
yeah.
come up every time you mention that.
Yeah, and no, and I have had a patient cancel a sinus lift because she was eating normal diet, but then she went across and became vegan, and it was against her act of thinking. So it was a bit sad. So I said, that's fine. I can't make vegan graft, so it is what it is. But it's people are asking, this is why, off topic a little bit, but this is why all the frenzy about the vaccine, where 20, 30, 40 years ago, polio and measles were everywhere and everyone just said, the doctor said you need a vaccine, do it. But now everyone's questioning science. Every second person is an expert, but they need to delve deep and don't read Facebook. This is what tonight's about, giving us some facts. And that's, graft is graft, it's calcium phosphate. So, but it is from coral reef. I haven't used coral reef yet, but it is from horse, cadaver, or human, or your own bone. Yeah.
And cadaver, you meaning human.
Yeah, human. The cadaver one I use comes out of Adelaide. And the other one before I was using it from America.
Okay.
Yeah. But I see that you ride a motorbike. I ride bikes and motorbikes. So, as I said, I've just broken something. So, not that you want to fall off, but if you ever do, if there's a defect, they'll graft.
Oh,
Okay,
yeah.
yeah.
I've come across, I had friends, my hips fading too.
Yeah.
But,
Yeah.
I just sort of didn't expect to hear about cow bones.
Yeah,
Just going
and that's what tonight's about. Rather, open up the book, give you all the truths. So there's no, and as I said, I've had one patient turn down treatment because they became a vegan. And I won't get into that debate. I'll be here all night.
Don't take much chewing, so it's pretty easy.
One quick thing in here helps save adjacent teeth. This has been proven. So just from a functional point of view, you lose a tooth down the back. The adjacent teeth over time, not everyone, but they can tend to tip in. The opposing tooth in the top arch tends to over-erupt. So by restoring a back molar, you actually restore function and you do maintain bone. And that's been proven as well. By having an implant there, it actually holds and supports the other bone. So it adds to function and form and keeps teeth there for longer. So it doesn't just work for that one tooth, it does support the rest of the dentition. And then long term, I get asked, how long do they last? Well, the implant really, if we place it well, should last a lifetime. The piece on top, it is ceramic, but it is harder than normal tooth material, but it is false, so you can chip them, but we can repair them. It may need the whole crown come off and replaced if it's chipped badly, but you can repair them. But hopefully if we do the implant well and we've got good bone, it's there for life. And that's that re-care bit where you come back and we keep an eye on them. I mentioned health protocols, so just quickly touching on that. Part of the study I did was in LA and they treat a lot of very wealthy people, but also they're in the movie industry and they can't afford to have much bruising and pain and they're more OCD and more difficult than myself. So one of our lecturers studied nutrition and came up with a health protocol. So obviously no smoking, but vitamins B, C, D, and zinc, magnesium, some electrolytes, and green smoothies. I put my patients on that protocol 3 weeks before surgery and at least 6 to 12 weeks afterwards. I've had some gentlemen come back with hair growing because obviously they've been lacking zinc. But once we started this protocol back in 2014, we ring our patients that next day. We had a lot less patients saying no pain relief at all or very little, less bruising, less swelling. So I believe it does work. It does make a difference. It just soups you up, as well as we use a normal mouthwash, salt spray if you're doing sinus work, and antibiotics and a little bit of steroids. So general medicine combined with a little bit of holistic does help in my hands and in my practice here. So simply, we make an appointment, then we do an assessment to see if there's any limitations with your health, any flags. Patients on bisphosphonates, so osteoporosis is a topical topic as well. And obviously pregnant, but smokers, we don't turn smokers away, but we try and limit them down to 5 a day, preferably or none. But everyone is different. Everyone heals different. So a bit of the current study that I'm doing at the moment, and the patients that we see, you'll take a tooth out and that patient, the tissue will be healing within 3 or 4 days. Same kind of patient, same kind of extraction, you come back 10 days later and it's just not healing as well. Everyone does heal different. And implants are no different as well. It's an unnatural process. God didn't design implants. What are we doing? We're drilling a hole into the bone of your jaw and we're screwing a metal object in there. But we're actually instilling inflammation, but we're setting off a healing process. And the properties of titanium, the body doesn't reject it. It actually has an osteogenic potential where the actual bone actually likes the titanium, which is what the implants are made out of. We're also, from a holistic point of view, we'll be embarking on zirconia implants soon. So that's a ceramic implant, no metal at all. For the reason, more from a health point of view, of not interfering with pathways and nerves and stuff like that. But the body does accept it. That's the take-home point. What do you need to know about the surgery? Local anaesthetic. So it's usually a lot less traumatic than actually having a tooth out. We do use sedation on our anxious patients. We bring a doctor in, you can have some twilight sedation. Healing, at least 2 to 3 months. We have a temporary, if it's a front tooth, we'll have a temporary plate to kind of like mask the gap. But it's normally a quick recovery. As I said, extractions and taking teeth out normally knock patients around more than actually placing the implant. And then recare, that's seeing our hygienist within the practice at least once, if not twice a year, getting a good flossing and brushing habit happening. You must keep the implant crown clean because you can have inflammation around the tissue. That will affect the bone, that will affect the implant. Same if your health was to go backwards with diabetes or smoking or something like that, that will definitely affect the implant. So what will you get after initial consult? It takes me, once we've had our initial chat, we've done our CT scan, and with my good friend Sam that you met in one of those photographs doing up your case report, it's good 4 to 5 hours of work before we get things even rolling. And then we may contact Jade and work in with Jade Dental, which is Justin and Darius, and discuss the case. I've actually shown Justin the case already tonight. You'll get the fees, what's involved, you'll get the proposed time frame. So that's the fees are what we talked about at the beginning, roadblock, how long is it going to take, and the steps involved, and then the medical and health protocols that I touched on as well. So all that is what we get together and put together for the only real cost involved to you would be the cost for the CT scan. The rest of it we do for an exam fee, but not a big fee before we get going. We do a lot of talking, a lot of planning. In some of the cases I'll show you, like that lady that, the nice words, they're a 12, 18, 2-year month plan. They go on for quite a while. So we get to know these patients quite closely. So I'm just going to look at some cases. And we've done 500 plus cases, probably more now, of implants. So we've done a lot of work. Missing back tooth, 14-year-old female from Gympie in good health. That's an X-ray of an implant against the natural tooth with a little healing abutment, we call that, on top. That's the healing little plug that you can see coming out from the gum. There's the abutment made out of ceramic, the white piece now joined with a little screw down to the actual implant. There's the screw. I'm looking straight down on that picture now. We tighten that obviously with a little driver. And then that's the crown on top. So that's a very old example, but just a simple one tooth. Front tooth, you can see the denture tooth on the top right side of the screen, her top left. You can just see a little gold piece up underneath. That's the actual implant in place. Missing front tooth there again, age 45. There's the abutment, and then there's the crown just gone on that day. So it matches in quite well. So that's a front tooth. Another case, front tooth. You can just see this tooth's a little bit darker. So it's actually had an infection in it. So that tooth had to go. We couldn't save it. Implant's been in place. There's the abutment again, and then crown on top. So it matches in reasonably well. There again, one of the most common teeth that we treat, one of the other front teeth, because often they get knocked, they might have had root canal done to them, and then that doesn't last forever, unfortunately, and then the tooth may crack and fail, and then it's either a denture, a bridge, or an implant. Jamie, are you there? Or can you just...
Complete yourself with the all-on-4 treatment concept.
Bit cold?
The dental implant solution
It's a
to
bit
make
cold.
you smile. This is Peter. Like many people of his age, Peter's been wearing dentures for a number of years. But Peter's never been happy with them. They often come loose when eating, and sometimes, embarrassingly, when talking. Peter constantly had to glue his dentures back on. This was quite annoying. He hated the feeling of the glue in his mouth. The dentures never really felt like a part of Peter, so he finally decided to talk to his dentist about an alternative. His dentist recommends dental implants, and especially the all-on-4 treatment concept, an implant solution that can return a lost smile on the same day of implant placement. With just 4 implants, an entire row of new teeth can be delivered. And as the implants at the back of the mouth are placed at an angle, even patients who have little jawbone left will be able to benefit from the treatment. This means Peter can have his implants fitted by his dentist and walk out with provisional teeth on the day of implant placement, allowing him to quickly return to leading a normal life. After the implants have healed in, Peter receives his customized set of fixed teeth that, with careful oral hygiene, can keep him smiling year after year after year, a result of decades of research and the latest technology. Peter now has more than one reason to smile. His new teeth feel great and really do complete him. He's able to enjoy his favourite foods and can speak with confidence again. If you're struggling with the same problems as Peter, speak to your dentist and find out if you too can complete yourself with the all-on-4 treatment concept.
Has anyone heard of the all-on-4 technique before? You have? Yep. So it's been around for a while now and it's working quite well. And we do that here. This is another little animation. If you could start that for me, Julian, please. But it's basically 4 or 5 or 6 implants where then you attach all the bridge work on top of that over time. And Nova Biocare is the company that I use. That's the implant company that we use. So this, that animation, just showing the implants, particularly the back ones, are angled so they don't go up into the sinus. And we have little attachments to allow the bridge work then to be attached and screwed in place. So it's quite technical, it's precision work. There's a lot of science behind the actual machinery side of it. That's just demonstrating the screw. So even if we're doing a single implant, that just gives it the same kind of animation of how we place a screw in the back of the actual crown to hold the crown onto the implant. Next example. So this gentleman, 60-year-old male, had a car accident many years ago, not many teeth left, and progressively started to lose some more as he went. So a broken off tooth there, a couple of teeth left, but nothing around the front. So that's looking up into the roof of his mouth. That's his denture in place. So all that pink stuff is acrylic and that's the plastic teeth. There are his lower natural teeth. This is the day of surgery. So Darius made this little jig for me. So those little holes are little channels where we actually put our drill pieces in. So that's all done with the planning on the CBCT and the software. That's the actual bridge work at the time of insertion. So you can see the little screw holes. So it's a bit like that all-on-4 case that we just showed you before, but it's actually got 6 implants in this case. There's an actual milled framework of titanium sitting underneath the acrylic teeth that go on top. Now, he was in a car accident, so those little screws at the top, when his face was reconstructed years ago, the implants you can see are those vertical rods in there. There is lower teeth there. So we actually left the 2 right teeth and that far back teeth in there for now. And we did 7 implants there in that case. Can you hit play for me, thanks? Yeah. Oh. It should be just on the screen there, Tommy, Julian. There it is.
So how did it go, Gary? How did the whole process go with your dentures?
Went well, maybe.
Yeah. How did the new teeth
So he's happy, it looks good, but the main thing with this gentleman, he was 60, he didn't care how he looked really, he can eat. He was sick of this denture flip-flopping around. So that was like 6, 7 implants. He had a stack of bone, so he didn't have to do a lot of grafts in that particular case. And he's travelling quite well. So that was done a couple of years ago now. This is just an example, 70-year-old female, loose denture and in pain. We did a full lower arch case. So here again, that's acrylic, a little clip there. She's only got 4 teeth left. So she had what we call a terminal dentition. Her next step was a full denture or consider the implant protocol. So she had a classic all-on-4 implants placed. That's just looking at the little metal housings on top of the implants. And that's the bridge work inside. There's a screw hole there, and there, with a metal bar underneath. And she comes in regularly, comes in twice a year. There's a little gap between the tissue and the bridge work that she can clean underneath. And she's functioning really well. She really should have had the top arch done as well. She couldn't quite afford it at the time, and she's coping okay. She's now in her early 80s. It's going quite well. So that's her 4 lower implants. And that's her smiling. This is another case. This lady came to see us. She's on her 6th denture on the top. So she had been everywhere and kept getting it remade because she wasn't happy, wouldn't stay in. She couldn't wear a denture. She was just a case that the denture just wasn't going to work for her. But she had no bone. So I had a colleague in Melbourne that we flew down in this particular case, and we did some special zygomatic implants that were done further back up into the roof of the mouth. Long story short, we finished the case and she's going really well. And she comes in twice a year and gets it cleaned underneath. You can just see the screw holes. But she was at a state of that she wouldn't go out in public. She was just like locked at home because the teeth kept falling out. And now she's swimming and getting on with life. This is just a teacher case, 60-year-old female teacher missing some teeth. So you can see there's a gap on the lower left. Her main thing was function. She couldn't chew. So there's the top of the implants after the surgery was done. You can just see the little healing abutments. There's the implants themselves sitting in the bone. Back to that cellular thing that we're talking about. So the bone's actually got to grow into the actual implant. That's the healing thing. So we've taken advantage of a healing process. We've drilled a hole, we've screwed this implant in there, but the body then repairs itself, actually embeds itself onto the actual implant surface. So that's the process of osseointegration. So it's something that's been researched and studied, and there's all different grades of titanium, and this is what worries me of patients that get anything from China or a cheap implant, is that there's alloys and different varieties of implants because it's cheaper, basically. And the pure titanium has been proven, along with zirconia, which is a type of ceramic, to be the most biocompatible. So the body accepts it the closest. When you start mixing alloys and playing with stuff that's obviously cheaper, you don't know what they can break down and give fragments into the body. Not as healthy, and the implants don't work as well. And the implants have been around 40 to 50 years, that's the research, so it's not a new thing. There's the implant crowns. You can see the screws on the top. Then we seal the little cover, the screw holes with some resin. This is just showing you a smile. So in there is some implants and some crown work. And that's a lovely local lady that sees us regularly, and a nice smile to finish off. I get asked about health issues. So this next case had diabetes, and we placed 2 implants on the front. Is everyone warm enough in here, or too warm? It's all good? Yeah. So she had a denture, so you can make out that that's a denture in the front there, 2 front teeth. That's without the denture, 2 missing teeth. And we place 2 implants right in the middle there. There's the x-ray showing the implants in place. And that's uncovering the implant. So this is stage 2. So this is at 3 or 4 months later. We're now going to take some impressions to actually make the crown work. So that's how we take the impressions. We put these little pegs up inside the implants. The impressions go off to Justin and Darius's lab. And then that's just a picture of the dentures. You can see how much the denture covers half of her mouth. She was just sick of it. And this is on the day of insert. So we take the little healing covers off. There's the tissue. So she was a diabetic. Diabetic patients don't usually heal as well, but she was well controlled, and it's healed beautifully. And that's looking at behind the crown. So you can see the 2 screw holes there that hold the actual crown work and the abutment, which is joined together in this case, onto the actual implants. And we seal those holes up. And this is looking from the front, and very happy smile. So that came out beautiful. Here again, most common implant we often do, front tooth, broken off, and there's an implant crown there, hard to match, hard to pick which. This is another case, broken that tooth off. An older gentleman, so the teeth a little bit darker. That's a natural long stain in that front tooth. So we extracted the tooth, we placed an implant, and we did do some grafting in this case. And that's the result. So Justin, with this case, to match it look like the same, he put that little line in there as well. So the tooth on this side is the implant crown, and the tooth on the left is his natural, and it's very hard to pick it. And that's why we use a really good local lab to get that characterisation. It is a form of art to match it in. That's looking in from behind. There again from the front. This is another case. This is more of a veneer case. We're just showing that we don't just do the implants, we're doing up the mouth. So we do a blend of things. So often a patient will come in wanting an implant, but their other teeth might need crowning or veneer work as well. And that's just the veneers in place. So the teeth were chipped and shortened, we lengthened them and closed up the gaps. And obviously made them a little bit brighter. This is an interesting case. Missing 2 front lateral incisors. She was born like that. She had orthodontics done to bring the teeth together. So we call them lateral incisors. She was a police lady and she didn't want to wear a denture anymore. And her line of work, she was a little bit active. So that's how she looked. Implants were then placed in those 2 gaps. And then that's the crown work that Justin did for us to match it in. And that's her smile. There again. Came up beautiful. She's not undercover anymore, okay. I mentioned before, concentrated growth factor, coming back to that grafting thing that we talked about. This is an Italian and Korean technique. And for different cultural reasons, they don't like graft too much. Well, if they're going to use graft, they're going to use it from their own body, not from a cow. And that's more of a cultural thing, not so much an issue with what the product is that they just don't want any other people or cadaver bone put in there. So what we've done here, we get QML to come in, and I do this for a lot of my cases. We take some of the blood, we take 4 vials usually, we spin it in a centrifuge. We do 2 spins, one for 2 minutes and one for 6 minutes. We then use, the blood separates out, so the red blood cells go to the bottom. So we're all our own healing factories. The body's amazing. You cut yourself, you have an injury, the body doesn't think about I need to heal. It starts healing instantly. So that yellow product is full of your own healing agents, growth factors, clotting, fibrin, which actually makes the clot form. And we take advantage of that. And there's what the graft looks like. So that's your bovine one there, probably mixed with a bit of cadaver. So those little powder granules is mixed with some of that blood product. So that's what it looks like. So, and this is one case. So this young lady had to graft. So this is the only gory one you're going to see. That's bone over the root. There's an implant in place, and I'm placing the graft in place. Sorry about that. She broke the front tooth off. And that's that same case with grafting, so it's matched in nicely, okay? And that's a very common case that we do, unfortunately. So that's the only gory one you're going to see. My other specialty, being in a country town, I wasn't happy with what was happening in orthodontics. So I've done a lot of study in orthodontics. So a third of my practice is orthodontics. The rest of it is advanced implants and just general dentistry. So this particular lady, 55-year-old female, sick of wearing a denture. So she's got a denture with 2 teeth, and she's got a gap in the middle. And in that gap, you can just see the metal work of a denture as well. We did braces first. We actually brought the teeth together, closed that gap. So there's that gap I'm talking about. So we brought the teeth together so we can put an implant in there and an implant over there. So there's that denture, looks awful. Now the teeth are magically together. So we did 6 months of mini braces, just brought the teeth together. You can just see the top of the implants. And then that's that on the day of insert. Ideally, it would have been good to veneer that, but she didn't want to spend any more money. She was happy with that. Her smile, but mainly function. She was sick of the denture. But we had to do braces first to kind of like finish the case so we could fit it in. Another case, similar. She had really crowded bottom teeth. She was wearing a denture on the top, so they are artificial teeth across the front there. Teeth missing here, and there across the front. So we actually straightened the lower teeth with braces. We had to do some grafting across the front because there was not enough room for the implants. That's what a denture looks like, a metal denture sitting up on the roof of the mouth. And we actually did a bridge. So we put 2 implants in the front with 4 teeth joined together. And there's some implants around the back. And that's the final photo. So teeth are fairly straight on the bottom, bridge work at the front, and some implants on the side. Bit more grafting, history of trauma, and we did an implant bridge. So that tooth there actually had an infection, so it came out. We put 2 implants in, and we did a bridge across the front. There's the bridge in place. This young fellow, 21-year-old, horse accident, he had some teeth knocked out. Here again, he had a big, you can see it's like clefted up a little bit. We did some grafting across there, so we grew some bone back. We taught him how to brush his teeth. You can see that he wasn't looking after them very well. That's the bridge work. We couldn't fill all the gap up with grafting, so Justin made some pink ceramic that actually represents the tissue that was missing that got knocked out in the accident. He was very happy, and that's his new smile. So then, he's only a 21-year-old, and hopefully he'll have that for a long, long time. Locator case, missing all the lower teeth. We placed 2 implants on the lower, and the other little grommets underneath the denture that fitted in place, and at the same time, an all-on 4 on the top. So I didn't actually do the implant work in this case, I just restored it. So one of those zygomatic big implants, other implants, and 2 on the bottom. It was mainly just to demonstrate what a locator case looks like. And that's just a denture with little clips to hold it in place. The patient can take it in and out. This is another case that we did. We did those implants there. You can just see it, it's about to clip into place. The denture sits down on those little clips. So the patient can still take it in and out and clean it. Full upper arch, so those teeth were failing on the top. There's the bridge work that went in that Darius made. There's all the screws, and there's her smile. And there's all the implants in place. And could you just, Julian, could you just hit play for that one for me, please?
lovely to see that reaction from your family because you feel so confident and beautiful, and then just to see them so happy, it's just so rewarding.
Oh, that is a great story.
Yeah.
Thank you for sharing that there.
That's all right. And thank you, Mark.
Okay.
So that was a case we completed this year. So she's got implants and some bridge work across the front there and some veneers as well. So these are some of the questions. We just did cover it. Safe. There is some pain involved, but hopefully not excessive. It's manageable. Costs, it is an individual thing. You've heard from me what we're going to get if you do come along and want a consult done. We do a lot of workup, explain the case well. We do use a top-class implant. We do use a top-class lab, so I'm not giving excuses for that. And will you need medication? Each case is different, but I've taught you a little bit about the health protocol with some normal medicine as well. That's it. Q&A now, so we'll just do some questions and answers. Can we have the light on? Thanks, ladies. You know how to do that one? And Julian's out the back to take some questions, and I've got Justin and Darius here, my lab team as well. So far away. And if you've got to just speak, yeah, the lights are on. If you want to just, we're going to be here for another half hour. So if you want to grab us and have a one-to-one chat, more than welcome. You guys have travelled a long way, so make sure you grab another cup of tea or coffee before you go. I've got staff at the back there if you want to make a free consult chat for down the track. They can make some bookings for that as well. So thank you very much for your attention. I'm talked out. Thank you.